Buen día para todos. Good morning, everyone. Antes de empezar, me gustaría recordarles que pueden elegir el idioma de audio de su preferencia. Before we begin, I would like to remind you that you can choose your preferred language. Esto lo hacen con el botón flor que tienen abajo a la izquierda y eligiendo el idioma desde la lista desplegable. Por favor, notar que a veces español o algún otro idioma aparece sobre el final de la lista, por lo que van a tener que bajar para poder seleccionar su preferencia. Please click on floor on the bottom left of your screen to choose your preferred language. You will have a drop-down list. Please note that you may have to scroll all the way down to see your options. Ahora sí, bienvenidos al seminario La investigación sobre drogas en el contexto de la COVID-19. Yo soy Paula De Masi, parte de la Comisión Interamericana para el Control del Abuso de Drogas CICAD de la Organización de los Estados Americanos OEA. Voy a ser la moderadora el día de hoy. Pueden dejar sus comentarios y sus preguntas durante toda la sesión a través del chat. El chat lo encuentran a mano derecha en la barra donde dice mensajes. Van a notar que hay tres ventanas: la ventana de operadores, la ventana de participantes y la ventana de privados. Por favor, escriban en la ventana de participantes, que es la que vamos a estar monitoreando, vamos a estar juntando todas las preguntas y sobre el final de la sesión vamos a responderlas. También les quiero aclarar que pusimos todos los documentos relacionados en la ventana en la sección de documentos, que también encuentran en la barra a mano derecha. Allí estarán todas las presentaciones en inglés y en español, también la agenda, y tenemos un artículo que publicó la CICAD sobre las consideraciones para la investigación sobre drogas y COVID-19. También toda la información sobre los próximos eventos y todas las presentaciones las van a poder encontrar en la página del Observatorio Interamericano sobre Drogas, hoy de CICAD. Y ahora con ustedes, el embajador Adam Nam, secretario ejecutivo de la CICAD OEA. Por favor, embajador, si puede prender su micrófono.
Thank you. Thank you. Good morning, Paula, and good morning, everybody. It's a real pleasure for me to be with you today. I like seeing the messages come in. I see Luis Alfonso from Pajo is with us, Francisco Cumcille, Pancho Cumcille, former head of our Inter-American Observatory on Drugs. Real pleasure to be with so many of you, if not in person, then virtually. It's a pleasure to welcome all of you today to this webinar on drug research in the context of the coronavirus pandemic, and hope you, your families, and your colleagues are all well. I know the pandemic has created challenges for research, particularly for studies that rely on face-to-face interviews. In addition, quarantines and stay-at-home orders have limited the ability to reach populations such as secondary school students, persons in treatment centers, prison populations, clients in drug treatment courts, and many of the other vulnerable populations that are the target of many of the programs, projects, and other interventions supported by CICAD and implemented in our member states. I know how important it is for you to track the evolution of the drug problem in your countries, especially during the pandemic. Things are changing. We in the CICAD Executive Secretariat share your concerns. So what can we do in an era when traditional research and monitoring methods may not be possible? That is exactly what today's webinar and future webinars organized by CICAD's Inter-American Observatory on Drugs will explore. CICAD has been working diligently for the past several months to mitigate the impact of the coronavirus pandemic on the drug problem in the Western Hemisphere. Allow me to share a few details on the efforts we have undertaken. We issued a paper in early May entitled COVID-19 and the Treatment of Substance Use Disorders, which provides guidance on treatment strategies during the pandemic. This paper is the result of a joint effort with Colombia and Paraguay, the chair and vice chair, respectively, of CICAD's group of experts on demand reduction, as well as the Pan American Health Organization. We've held webinars on this topic to further educate our member states and others, and are planning a series of dialogues with civil society on demand reduction issues starting this month. We've held 3 webinars on alcohol use during the pandemic. Free from prohibitions on drinking in the workplace, those working from home are vulnerable to alcohol use that can affect their job performance in addition to their family relationships. We have held several virtual events to discuss alternatives to incarceration for drug-related crimes. As countries seek to reduce prison populations because of the risk of the spread of COVID-19, alternatives to incarceration such as drug treatment courts and diversion programs become even more important. In the area of supply reduction, we just inaugurated the first of several virtual courses at our Regional Counter-Drug Intelligence School of the Americas, known by its Spanish language acronym CICAD and based in Bogota, Colombia, run jointly with the Colombian National Police. We're also planning virtual courses for a parallel school of English-speaking Caribbean member states. In the area of drug research, we have already taken a number of important steps. We published a paper entitled Consideration for Drug Research and COVID-19 to assist member states with monitoring drug use. A recent CICAD survey of OAS member states show that most countries believe drug consumption and dependence is likely on the increase due to social isolation, with drug treatment services sadly reduced due to restrictions on face-to-face contact. You'll hear more about the results of this survey during today's event. CICAD also conducted a survey of OAS member states on how narco-trafficking has been affected by the pandemic. The responses indicate that, not surprisingly, criminal drug traffickers are taking advantage of national and global vulnerabilities. Although some trafficking has been disrupted by the pandemic, drug control authorities are currently experiencing significant difficulties in performing their duties because a sizable amount of their personnel and financial resources have been reallocated to security and humanitarian tasks related to the pandemic. On June 19th, we launched an online training series for national early warning systems and continue to expand the early warning system of the Americas. Today's event is the second online training event in this series, and there will be more events in the coming weeks. I'm also pleased to let you know that the CICAD Demand Reduction Experts Group is in the early stages of planning a survey that will be conducted in OAS member states to look specifically at the effect of the pandemic on drug use. CICAD has been forced to adapt and rise to the challenges of the pandemic, haven't we all, both professionally and personally? And we are thankful for the support shown by member states, evidenced by the very high level of participation in the web-based activities and initiatives we have implemented. Our donors have also been very supportive of these efforts. I'm grateful to the Government of Canada for supporting today's webinar, which forms part of the project entitled Early Warning Systems in Response to Opioids and New Psychoactive Substances in Latin America and the Caribbean. I am sure today's event will provide food for thought on how we can continue the necessary research and monitoring required for the development of effective policies and responses to the drug problem. I wish you an informative session and best of luck as all of you continue your important work. Thank you.
Muchas gracias, embajador Nam. Con ustedes, María Hines, jefa del Observatorio Interamericano sobre Drogas, hoy de CICAD.
Good morning, everyone. We are living in unprecedented times, and I know everyone keeps saying that over and over and over. But the fact of the matter is, the COVID-19 pandemic took the world by surprise. And what at first seemed like a severe flu or a MERS or SARS-like illness, as time went on, we began to understand COVID-19 as its own disease with a unique structure, its own long incubation period, its own transmission rates. And for the past 4 months, 6 in some cases, most of us have been unable to think about much else other than COVID-19 and how it is affecting our lives. However, the fact remains that we were already experiencing epidemics of other types before COVID-19 appeared. And those illnesses remain and certainly will continue after COVID-19 is gone or at least controlled. The opioids epidemic in North America and Europe has claimed hundreds of thousands of lives alone. And there are thousands more people who die each year due to other substance use. So in the context of COVID-19, what are we doing, or what should we be doing, or what can we do about the drug epidemic that we're already living in? Presently, there's very little information on the relationship between COVID-19 and substance use, or the potential impact of COVID-19 on the drug problem in general. In part because COVID-19 is still, in the large scheme of things, quite new. But this lack of information makes us ask lots of questions. What are the increased health risks for people who smoke or vape or use other drugs? What's the impact of COVID-19 on the mental health of users and society at large? How will individuals access treatment, and how will their treatment change as a result of COVID-19? And what are the best practices in these cases? How do we provide services? How do we do methadone maintenance? What about cannabis use or alcohol use? Will it increase? Will it decrease? Will it remain the same? And for the people who use those, will there be other impacts on their health as time goes on? And in order for public health systems to be able to effectively respond, the answers to these questions must be based on valid and reliable evidence. So in this sense, I hope, at least for me as an epidemiologist, the COVID-19 pandemic serves to remind us of the importance of science as an effective tool in fighting disease, all disease, and as well as continuing active public surveillance and monitoring, gathering data to respond to new and sudden changes, how this impacts vulnerable populations. All of these things need to be based on good scientific evidence. So how can we collect that evidence in a context where our traditional research methods simply may not be possible? And that is part of what we would like to begin to address today. This webinar is part of a training series that we developed with funding from Canada. It falls under our project on early warning systems in response to opioids and new psychoactive substances in Latin America and the Caribbean. And we are grateful to Canada for their support to this project. COVID-19 is an emerging issue. Much like many of the other drugs that we deal with, much like many other problems that we face, it came on suddenly, and our ability to respond to it is affected by how quickly we are able to gather information on it and how quickly we're able to develop our responses based on that information. We have three distinguished researchers today, two from Canada, one from Mexico, who will share with us some of the research on substance use within the context of COVID-19. We'll also be sharing information on what CICAD is doing in response to the COVID-19 crisis. Ambassador Nam just mentioned some of our activities. The OID, the Inter-American Observatory on Drugs, is working with the Demand Reduction Unit to design an online survey instrument that countries can use to assess the substance use information, or substance use situation, during COVID-19, and you'll hear more about that shortly. The OID has also carried out an assessment with national drug observatories to look at how their operations are being affected by COVID-19. So we hope you find this webinar interesting, and I hope it provokes some thoughtful discussion on how to gather good scientific evidence on substance abuse within the context of this current pandemic. So before we move on, just a quick reminder, please use the messaging tab to ask questions. At the end of the presentations, we will read questions aloud for our speakers to answer. If you require interpretation, please be sure to click the drop-down list on the bottom left-hand of your screen that says floor in English. And you can scroll down, and there is English, Spanish, Portuguese, and French available. So please scroll down to find the appropriate language, and also copies of all of our presentations are available in English and Spanish in the documents area on your screen. Y repito en español por las dudas. Si necesitan interpretación, se puede encontrar el idioma que usted prefiere, inglés, español, portugués y francés. Favor de hacer clic en el rincón abajo en la izquierda de su pantalla y escoger flor para encontrar la lista. Hay copias de todos los documentos en inglés y español en la sección llamado documentos. Y así pueden acceder copias de todos los documentos. Y finalmente, no olviden poner sus preguntas en la sección de mensajes para participantes, no para operaciones. Esos más bien son para esos problemas que uno puede tener técnicamente. Sus preguntas deberían ir en mensajes bajo la sección de participantes. Vamos a recopilar las preguntas y vamos a leerlo a los ponentes al final. Welcome all, and thank you for participating in what I consider to be an unprecedented webinar for the OID. I now return the floor to our moderator, Paula Damasi.
Muchas gracias, María. Llamamos entonces ahora al piso a Pernell Clark y a Jimena Kalowski. Si pueden, por favor, pedir la palabra. Bien, entonces comenzamos con el siguiente módulo.
Can you hear me?
Sí, Pernell. Te podemos escuchar perfecto. Entonces les presento a Pernell Clark, especialista del Observatorio Interamericano sobre Drogas, hoy de CICAD.
Thank you very much, Paula. Good morning to everyone. Thank you for participating in this seminar. As Maria said, it's one of the first of its kind that we are presenting. What I'm going to do very quickly this morning is to give you a very brief introduction to internet surveys and present some of the results of the survey that Maria had mentioned. We undertook a survey of National Drug Observatories a few weeks ago, and I'm going to share some of those results for you. So it's going to be a very brief presentation, broken down by a basic introduction to internet surveys, present some of the results of our very own survey that we did, and then leave you with a few conclusions. So I'm going to start with traditional surveys. As many of you know, we have relied quite heavily on traditional surveys that use well-defined populations. Many of you who are familiar with our CDUC, our Inter-American Drug Use System methodology, will be familiar with our general population surveys, our secondary school student surveys, treatment center patient surveys, as well as university students, where we can clearly define those populations. We know how many people there are in these populations. We know the size, we know the age distribution, we know the distribution by sex, etc. So that means that from these populations, we can take probability samples, random samples, where the sample itself adequately represents the population that we're looking at. We have, of course, also relied on face-to-face interviews, self-administered surveys, and in the past, very few online or web-based surveys. And of course, most of these studies have allowed us to receive or achieve, results that we can extrapolate to the population that we're studying. So this is what we have traditionally done. Then COVID-19 happened, and many of us were forced to quickly transition to web-based or internet surveys because, I mean, let's face it, in many cases, this is the only alternative we had. And essentially, in many places, it is still the only alternative that we have. The Pew Research Center, which is an agency headquartered in Washington, D.C., it refers to internet surveys as having their drawbacks. And even though many more of these surveys are being conducted via the web today, we have to be aware of the challenges that these types of methodologies give us. And I think it's important because many of us who haven't used these types of methodologies before are now using them without, in my opinion, fully understanding the implications of these types of surveys. So for example, surveys of the general population that rely on the internet are subject to significant biases, as it says here. We have poorly defined populations because of either under coverage or non-response. I mean, the truth is not everyone in a country has access to the internet, even though many of us believe everyone has a cell phone. It just is not true. Not everyone has access to the internet, and those that do don't necessarily have good access to the internet. So there are significant demographic differences between those who do have access and those who do not, and those who have good access and those who don't have good access. This is the so-called, as is referred to in English, the digital divide that we have to be aware of. So for example, specifically, people with lower incomes, less education, persons living in rural areas, older persons, for example, are usually underrepresented among internet users because those with high-speed internet access have different demographic characteristics. So we have to be aware that internet surveys are naturally subject to these biases. Again, because of those poorly defined populations, we usually are forced to use convenience samples because we're not sure what the population is. We don't have access to the entire population. Sampling is difficult. Therefore, these types of surveys, it's a challenge for doing estimates, totals, fractions, prevalence, incident, things like that. This can be challenging, not impossible, but challenging. Obviously, these surveys are deployed via web-connected devices, cell phones, tablet computers, desktop, laptop computers. The surveys are delivered through web pages, social media pages, email, pop-up pages, and according to the RAND Corporation, another agency here in the USA, this is referred to by them as uncontrolled instrument distribution. Yeah, that's a mouthful. Basically, it means that you have very little to no control over who will access your survey, who actually fills it out. And in some cases, even though you can control for this in many of the survey platforms, sometimes you don't have control over how many times an individual fills it out. Many platforms, they can detect when a specific computer has already completed a survey, but there's nothing stopping me from doing a survey on my laptop, then doing it on my desktop, then doing it on my cell phone, and things like that. So we don't have a lot of control over that. So we have these inherent biases in internet surveys. And of course, that prevents us in many cases from extrapolating those results to the general population. Essentially, this means that we can't speak definitively about the population that we're targeting. So these are the things that I think we need to take into consideration. And this is something that we will explore in future webinars, but we wanted to touch on this just briefly in this forum. Now, just let me be clear. I'm not saying that all internet surveys are bad. I'm not saying that at all. I just want to caution those of you for which this approach might be new to be aware of and to understand the limitations of this approach. But of course, internet surveys can be used to do estimates when your population is clearly defined. When you know the quantity, the characteristics of your population, when you can do a sample, do probability sampling. For example, if you are targeting a specific organization, let's say the Organization of American States wanted to do a survey of its staff. We all have email addresses. The Human Resources Department has all of those email addresses. They know who we are. They can either do a census of that, survey everyone, or they can take a random sample. That is possible when you have a small, controlled, clearly defined population. But for things like the general population, it doesn't always work like that. Registrants at an event. So for example, we could do a survey of all of the participants of this seminar, we can easily use an internet survey to do that. Or national drug commissions. We know who all the national drug commissions are in this part of the world, and we can easily do a web-based survey of these agencies. So I just wanted to leave that with you, and then quickly transition to speaking of national drug commissions. The CICAD Secretariat actually deployed a survey on Thursday, the 21st of May, via email. And it was sent to all CICAD commissioners, basically to ask them about the impact of the COVID-19 pandemic on aspects of the drug phenomenon in their countries. And then the observatory section of CICAD, the OID, we liaise with the national drug observatories in the member states to have them coordinate the completion of this questionnaire. So the survey was deployed in an email link to the questionnaire on the online platform hosted by SurveyMonkey. It consisted of 6 basic, simple questions, and the countries were asked to fill out the questionnaire only once in response to the survey. We had 27 countries out of a total of 34 participating in the survey. And that gave us a response rate of 79.4. We think all of the sub-regions were well represented, all of North America and the vast majority of the countries in the other sub-regions, South, Central America, and the Caribbean as well. So one of the questions that we asked, and this is something we've been talking about and hearing about among this group in the news, it's all over the place. How will the pandemic affect substance use in your country? And as you can see from the table, we had the vast majority of the countries that responded saying that they thought that because of COVID-19, there would be an increase in drug use. Only 1 country thought that there would be a decrease, and 5 countries indicated that they didn't think that drug use would change because of the pandemic. The follow-up question was an interesting question. We asked them, do you have any specific evidence to support your answer? So on what are you basing this response? And this is where it gets fairly interesting. Only 15 of the countries indicated that they had specific evidence to support their response. And these are some of the things that they pointed to as evidence that there would be an increase, or there has been an increase in drug use. Many based their response on the fact that treatment facilities in their country reported an increase in alcohol use. They saw an increase in overdoses and related deaths, an increase in the number of people experiencing unsupported withdrawal, increased number of alcohol purchases at groceries and supermarkets and other establishments. They saw an increased number of distress calls to helplines, those countries that have helplines. So we have these are some of the most, so when the countries indicated what evidence they had, we took the most popular ones and put them on the list here. This is not an exhaustive list, but these are the most popular responses that we got. Increased number of calls to treatment facilities and counseling services. A couple of countries actually mentioned increased activity on social media on comments related to stress, to COVID-related stress and drug use. And then 1 country actually quoted a survey that was done where 26% of the persons reported that they have increased consumption of certain behaviors, alcohol use, tobacco use, gambling. So these are the reasons that were cited by those 15 countries for why they thought drug use would increase or have increased. We also asked about treatment and how it has been affected by the pandemic. 23 of the countries, the vast majority of them said yes, treatment was affected. Only 4 countries responded no. When we asked about the specifics of those effects, things cited were the suspension of admissions because of the quarantine. So persons just were not able to get into the treatment centers for their problematic drug use. They mentioned the difficulty of implementing new protocols to facilitate social distancing, Healthcare responses in many instances were adapted to virtual or telephone care when feasible for the client or the patient. Many residential services were forced to create special spaces for isolation for those persons prior to admission to the facility, as well as during their time if they were admitted in the latter part of the pandemic. In one particular country, mental health counselors and social workers were actually redeployed to focus specifically on the COVID-19 pandemic. So they were pulled away from the counseling and treatment services they provided to do contact tracing for COVID-19. There was a temporary closure of the drug treatment court in a couple countries, and the suspension of drug testing, of course. And the last one I think was very interesting for countries where there's substitution treatment available. They had to implement a greater amount of flexibility in prescribing, dispensing, and distributing controlled substances to those persons who needed them. For example, giving a longer, more of the substance for a longer period to avoid the patients having to go back to the facility. So give them a longer prescription. And of course, this raises a whole set of other questions, which we won't get into in this webinar. And then, of course, we have aftercare and support groups who, as I mentioned before, had to transition to Zoom and other online forums to continue their work. So this is how treatment was affected by the pandemic. One of the other questions that we were interested in was how were the National Drug Secretariat's operations affected by the pandemic. So countries were asked to describe the restrictions that were imposed, and most countries, of course, had a number of different restrictions in place, either all at the same time or at various times during the pandemic. But the most popular restriction, as you can see from the table here, was working from home. 23 out of the 27 countries, or 85%, reported that this was implemented during the pandemic. This was followed by reduced staff in office, rotating schedules. So you would have a group of persons working on one day, and then they would rotate out, and another group would come in on another day. Also, we had 12 countries that reported partial operation in office, and then a few other arrangements were made as well. Only one country reported that they interestingly maintained full operation during the pandemic. One of the other questions we asked, which we're very interested in, of course, as the Inter-American Observatory, is what type of studies are countries planning to do? So countries were asked about plans to conduct specific studies related to the coronavirus pandemic and drugs. And as you can see in the table, we had 19 countries that indicated they were planning studies on drug use. 16 said they were going to do a study on drug treatment. 10 said they were interested in drug trafficking. And 6 indicated that they would do some type of a study on COVID-19 and the health risks associated with COVID-19. Now, 7 countries indicated they would do other types of studies. And when we actually drill down in the open-ended responses to this question, some of those 7 countries indicated they were doing studies on mental health and COVID-19, biopsychosocial factors, social connectedness and isolation on health, well-being, illness and recovery, stress management in related to COVID-19, drug overdoses, and the impact on the therapeutic communities during the pandemic period. So we have a broad range of work that countries have indicated that they're planning to do, and we will be following up with a number of the countries here to see how we can support or participate and have everyone else benefit from the results of these studies. So in conclusion, most of the countries, 20 out of the 26, one of the countries didn't respond to this question. So 20 out of the 26 that responded to this question thought that drug use would increase. Just over half of the countries indicated that they had specific evidence to support this. Most countries indicated that treatment, the vast majority of countries indicated that treatment was affected, and they provided the ways in which treatment was affected. And each of these things can be a seminar in itself. If we drill down on the information that the countries provided here, excuse me, I think each of these topics could be a separate seminar. Working from home was the most popular restriction implemented in most countries, and most countries were planning studies on drug use, just over half on treatment, and less than half will be looking at trafficking as it relates to the COVID-19 pandemic. So I am going to stop here. Thank you very much for your attention, and I hand back over to our moderator, Paula.
Muchas gracias, Pernell, por la presentación. Llamamos entonces a Jimena Kalowski, que por favor se una al piso. Jimena es la jefa de la Unidad de Reducción de la Demanda de la CICAD OEA. Mientras esperamos que se conecte, les recuerdo que estamos esperando sus comentarios y sus preguntas a través del chat que pueden encontrar a mano derecha, en el chat de participantes. Adelante, Jimena, gracias.
Perfecto, ahí parece que me oigo. Sí, muchísimas gracias. Bueno, muchas gracias por invitarme para poder comentar un poco el tema de la necesidad de contener o de tener información en el contexto del COVID-19. Realmente los datos que acaba de mostrar Pernell son muy relevantes para el trabajo nuestro. Nosotros desde la unidad de reducción de la demanda apenas empezó la pandemia y sobre todo las restricciones de las personas para poder movilizarse en los diferentes países, nos planteamos en primer lugar cuáles eran las urgencias que podíamos tener. Y de esa manera, como mencionó el embajador Nama anteriormente, trabajamos en unas recomendaciones junto con la OPS y con la presidencia y vicepresidencia del grupo de expertos de reducción de la demanda, que es Colombia y Paraguay, en algunas recomendaciones para poder sostener los programas de tratamiento en este periodo, porque estimamos, y está demostrado también con los resultados, con las opiniones de las comisiones de drogas, que justamente la población que consume drogas es una población especialmente vulnerable y que probablemente iba a tener dificultades de acceso o de continuidad de su tratamiento para el consumo. Entonces, en los primeros días nos pusimos rápidamente a trabajar en esas recomendaciones, tomamos contacto con España para ver un poco, dado que ellos ya llevaban más meses o más semanas en la pandemia, para ver cómo se habían organizado y qué buenas prácticas nosotros podíamos rescatar en ese momento. Pero luego nos encontramos con varias afirmaciones de las que también ha comentado María, en términos de que la opinión general era, pensamos que va a aumentar el consumo, o es evidente que se va a aumentar el consumo de sustancias, pero realmente datos respecto a eso no teníamos, y sobre todo qué tipo de sustancias podría aumentar el consumo. Hoy en día, ya pasando más tiempo, tenemos información, pero es una información más bien casuística, de algunos países que dicen, mira, no ha aumentado el consumo porque en nuestra situación en particular se ha restringido mucho la movilidad de las personas, por lo tanto no hay mucho acceso. U otros que dicen, sí, tenemos mucho acceso, se ha facilitado mucho el consumo de alcohol, pero todos estos son datos que necesitamos nosotros tener de manera mucho más sistemática, de manera más certera, y por eso que es tan importante el trabajo que se plantea y que se propone con excelentes expertos el día de hoy. Nosotros necesitamos, desde la reducción de la demanda, mirar qué ha estado pasando con los programas de tratamiento, información que Pernell ya nos entregó de manera bastante importante, qué implicancia tiene para los programas de tratamiento el trabajo desde el hogar, porque cuando uno piensa en las condiciones de droga, el trabajo desde el hogar se puede facilitar un poco más porque hay mucho trabajo administrativo. Sin embargo, los programas de tratamiento han presentado algunas dificultades con el trabajo a distancia. pero necesitamos tener información de eso. Lo mismo respecto a los programas de prevención. Los programas de prevención en general están bastante estructurados sobre trabajos grupales para fortalecer redes de apoyo, ya sea con las familias, en las escuelas o en las comunidades. Entonces también necesitamos tener información de qué ha ocurrido con los programas de prevención para que nosotros podamos también pensar cómo podemos o debemos reestructurar nuestros programas preventivos para poder mantenerlos en este tiempo. Por la información que manejamos al día de hoy, es muy probable que la pandemia nos va a acompañar bastantes meses más y sobre todo las restricciones en los países se van a sostener un buen tiempo. Por lo tanto, es necesario que podamos abordar estos temas con información exacta, no solamente basado en lo que yo creo que puede ocurrir, porque realmente las condiciones son distintas, nos toman a todos de sorpresa. Hemos tenido bastantes webinars con expertos, pero necesitamos poder tener información. Por ejemplo, uno de los aspectos que se señalaba en un webinar la semana pasada es que estamos en algunos lugares incluso fortaleciendo la supervisión parental en el sentido de que los adolescentes, los niños, pero sobre todo los adolescentes están pasando más tiempo en las casas y los papás están pudiendo tener mayor espacio de convivencia con ellos. Pero eso puede no ser tan así, sobre todo en sectores donde sabemos que las personas viven en mucho contexto de hacinamiento y por lo tanto también la violencia puede ser un factor que esté aumentando en este momento. Y no sería tan protector esto de mantenerse en estos periodos largos en la casa. Por lo tanto, el trabajo que estamos haciendo ahora desde el grupo de expertos, en conjunto con el OID, para saber más o menos una opinión respecto a cómo se ha afectado el consumo de sustancias en la región, es muy relevante para poder tomar decisiones y poder orientar también a las comisiones de droga en la toma de decisiones. Y en ese sentido, toda la información que podamos recolectar ahora, tanto de nuevas sustancias psicoactivas, el uso de opioides, cómo se ha visto afectado en este momento, qué pasa con los síndromes de abstinencia, qué pasa con la medicación, así como la continuidad de los programas y las nuevas prácticas que se están implementando son absolutamente necesarias. Otro aspecto que también me interesa resaltar es que estamos comenzando a tener varios diálogos, ya lo comentó también el embajador Nam, con las comisiones de drogas, con la sociedad civil, y en ese sentido también es muy relevante poder contar con información certera respecto a lo que está ocurriendo. Sabemos en nuestra región, ya los datos lo indican, pero también esto se va a ver acrecentado, ya tenemos una crisis económica importante, la pobreza y el acceso a los recursos va a estar muy restringido, la pobreza va en aumento, que es un factor de riesgo importante para el consumo de sustancias. Y además es algo que facilita también la entrada del tráfico de drogas o la entrada a las redes del tráfico de menores de edad. Por lo tanto, también en ese sentido, poder contar con toda la información respecto a la oferta, a cómo se están organizando y distribuyendo las drogas en los distintos países, impacta directamente lo que nosotros podemos hacer desde los programas de reducción de la demanda. Y así como los datos que podamos obtener, toda la información que podamos recopilar va a ser fundamental para ver cómo esto va a impactar en el diseño y en la mantención de políticas y programas sobre drogas. Junto con eso, también nos preocupa el financiamiento de los programas de drogas, nos preocupa el financiamiento de las comisiones de drogas, en este contexto en que de empobrecimiento, pero también de que probablemente algunos de los recursos se puedan destinar a la atención de urgencia de los pacientes con COVID. Y sabemos nosotros que en este momento algo que se está viendo muy afectado es la salud mental también de la población general, de las personas consumidoras de sustancias y también de las personas que trabajan en la primera línea en relación a esta enfermedad. Por lo tanto, el poder tener esa información disponible para poder tomar buenas decisiones es algo muy relevante en este momento. Así que yo creo que este webinar del día de hoy no solamente es muy necesario, sino que además es muy relevante, dado el panorama en el que estamos inmersos hoy en día. Así que, bueno, solamente quiero escuchar a los panelistas que vienen y felicitarlos. Y bueno, tenemos un muy arduo trabajo por delante en el que necesitamos que cada uno pueda hacer su parte para que esta cadena de información, programas, ejecución de programa, evolución y evaluación pueda tener su curso lo mejor posible. Muchas gracias y los felicito nuevamente por esta iniciativa.
Muchas gracias, Jimena, por tus palabras. Ahora llamamos al piso al doctor Matthew Young. El doctor Matthew Young es analista senior de investigación y políticas del Centro Canadiense sobre Uso de Sustancias y Adicciones. Perfect.
Hello, thank you. Can you hear me well?
Yes, we can hear you perfectly.
Wonderful. If you would mind bringing up my slide presentation, that would be wonderful. Thank you so much for inviting us to present some of our work here. It's a great honor, and I hope that some of what we have to present, both my colleague, Dr. Cnferencia, and myself, that work will be of interest and potentially of use. So maybe just to begin, I'll quickly run through, just to quickly describe who we are. So we're from the Canadian Centre on Substance Use and Addiction. This is a not-for-profit organization that operates in Canada. We've been around for about 30 years. We were created by an act of parliament in order to provide kind of unbiased, evidence-based advice to the Parliament of Canada. We also work with a lot of our stakeholders across Canada to reduce the harms associated with substance use and addiction. Next slide, please. So what we're going to do is we're going to separate out our presentation over the next two kind of sets between myself and Dr. Paradzi, and we're going to talk about first I'm going to talk about the illegal substances, and then Catherine will talk a little bit more about the legal substances. Next slide, please. We can move through some of these slides. These are included for your information, so if you want to know a little bit more about our organization. So next slide again. And maybe we'll move forward to the outline for today, for the session. Next slide, please. So first I'm going to give you just a really quick, just because I know I live in Canada, but you all, not everybody on the line does. I'm going to give you a little bit of an idea about what Canada's about, and then we're going to talk about the illegal and illegal drugs. So next slide, please. So just sometimes it's helpful to put what I'm going to present in context. So Canada, by population, is a relatively small country, about 35 million people. We have one of the highest per capita immigration rates in the world. So this is this means that we're a very diverse population. We're about 60% English and about 25% French, and then about 7% other. We're the second largest country in the world with 6 different time zones and 1 land border. And this has an effect on things because, next slide, please. What we see, the trends that we see happening in one area of the country are vastly different than the trends we see happening in other areas of the country. We have 13 provinces and territories, and a lot of our healthcare data is administered by the province territory, as well as a lot of the enforcement data that we get. So it can be the data that we have access to at the national level can be very heterogeneous. And so given that, sometimes it can be difficult to bring together data at the national level. Next slide, please. I'll go in a bit into some of the trends when I talk a bit about background on the next slide. But what I would like to say, though, is one of the things that we have noticed over time is, as I said, trends can be very different in different areas of the country. And we have noticed, speaking with our American partners, that sometimes the trends have more in common north-south than east-west. So we do notice that, say, for example, the province of New Brunswick has a bit more in common with trends with the substance use trends that take place in Maine than British Columbia. And similarly, British Columbia has more in common with what's going on in Washington State than what goes on in New Brunswick. So next slide, please. So to begin, next slide, please. So to begin, I'll talk a little bit about the illegal drug situation before. I'll go through this fairly quickly. A lot of this data that I'm presenting comes from our cost of substance use in Canada that was released yesterday. So this is pretty fresh data and is available at our website. It's www.csuch.ca, csuch.ca. So if we look at in 2017, the year for which the most recent death data were available across all substances, substance use in Canada was estimated to cost about $46 billion. This is an average or an overall cost of about $1,300 per capita for every man, woman, and child in Canada. And among this, the legally available substances at the time, because this was 2017 and cannabis was made legal later, accounted for about 63% of these costs, with alcohol leading the costs. Next slide, please. Now, one thing that is important to note here is that at the onset of COVID-19, Canada was in the midst of an opioid crisis, and Maria referred to this, alluded to this earlier, but this is important to note. So, and these are some of the deaths from our study. So this study looked really at both the conditions that would be considered fully attributable as well as partially attributable to substance use. So this would include all the opioid poisoning deaths, but then it would also include any cancers that would be attributable to alcohol consumption as well. And we can see here that that in terms of deaths, tobacco still leads the pack, but alcohol is behind. Opioids comes in third, and then we have cocaine coming in fourth. So and you can see here between 2015 and 2017, the number of deaths creeped up quite significantly there, and that's continued to creep up till about 2019. When we saw data produced by the Public Health Agency of Canada show that there was a slight decrease, and some of our partners in the various provinces showed that it had either stabilized or decreased in about 2019. But as we will see when I get into more recent data since the onset of COVID-19 appears to have affected that trend, and we've backtracked on a lot of the progress that we have made. Next slide, please. So this is really talks about the number of potential years of productive life lost. So this really just underscores the point I made in the previous slide. So we can move on to the next slide, please. Next slide. There we go. The other thing that we noticed too was that the opioid crisis, for a number of reasons that are not fully understood, seemed to be morphing into more of a substance use crisis. And so what we did see is that we noticed that between 2015 and 2017, cocaine per person cost, which is a really nice, it's a nice measure that includes the costs associated with hospitalizing people for cocaine attributable disorders, as well as the criminal justice costs, the costs associated with lost productivity due to premature mortality and disability removed from the workforce. So it kind of is this measure of cost, or per person cost at least, is a nice meta measure of a lot of the harms associated with substance use. So cocaine per person costs increased 10% of the years 2015 to 2017, and CNS stimulants, which really was mainly methamphetamine in Canada, increased 22% over that time. And we did, and this is reflected in a lot of our partner comments about that we hear from a lot of people working in treatment, harm reduction, and law enforcement. Next slide, please. So this is this is kind of the landscape that we saw before. So so why were we in this? I think one of the things that's important to note, and many of you will be very aware of these, that the opioid crisis and the subsequent methamphetamine crisis, or methamphetamine harms, increase in methamphetamine harms that we witnessed, was really due to a complex set of factors. But one of the important ones here that I wish to point out was really the unpredictable illegal drug supply. As you may know, in approximately 2013, 2014, we had fentanyl creep into the illegal drug supply, and this made it very difficult for people to use in a way that posed the least risk of harm to them when using. Next slide, please. So I know that part of the interest among people attending this this session is also to learn a bit about the methodologies that we use and to come up with some of our information. So I presented to you our cost study, and I can provide more information if you're interested in following up on that. But another way that we detect early trends is through a group called the Canadian Community Epidemiology Network on Drug Use. This is, the acronym is CENDU. And what this really is a series of sentinel sites from throughout Canada, who are sometimes based communities, sometimes at the provincial or territorial level, and they collect data on local drug use trends and what they see. They rely heavily on contacts within the community of people who use drugs, as well as a community of people working in harm reduction. And they also draw from people who are like coroners, people working in law enforcement, homeless shelters, etc. So this provides us a really good opportunity to be able to detect trends. But as you will see later on, even though we may get anecdotal reports of these trends, it's hard to get that data to come and support those anecdotal reports in a timely fashion. Next slide, please. So before before the COVID crisis began, we did an in-depth examination of from our a lot of the samples that were seized by law enforcement in Canada to look at the extent to which there was a contamination in the illegal market in Canada. Next slide, please. And we noted at the time that a big contributor of harm certainly was the level of contamination. So we found that opioids and stimulants were accompanied by other psychoactive substances in 5% to 13% of samples analyzed by Health Canada's Drug Analysis Services. If you include cutting agents or bulking materials, that went up to almost 69%. So I'll leave the other pieces of information in here for your own interest, and you can also look at the CENDU bulletins. But this was the landscape before COVID. So let's move on to COVID. Next slide, please. I'll move on to the next slide, please. This is one of the sources of information that is extremely useful to us. Is a lot of our partners working in harm reduction do drug checking, and this is where an individual is able to bring the drugs that they have purchased in the illegal market into a harm reduction site where they can have those drugs checked. This can be done using kind of fentanyl strips or FTIR spectroscopy. But it's able to kind of give a good indication of what else is in the drugs that the people are planning on using. And so we developed these infographics from the samples submitted to drug checking services in Canada. This is the opioids, and then if we go to the next slide, this is the stimulants. Again, I have a lot of slides in here, but I wanted to you to have all this information, even though I can't spend a lot of time delving deep into them. So stimulants as well, we find are highly contaminated. Next slide. So what do we know about the illegal drug situation since COVID-19? Next slide, please. So in May 2020, we released a CNDU alert that talked about changes related to COVID-19 in the illegal drug supply and access to services and resulting health harms. And this was a very challenging alert for us to put together. We sent out a request for information to all of our partners in our CNDU network. And it was really at the time when we put this alert together, because we collected data during about the month of April in order to be able to put it out in May. And it was really difficult because a lot of the data were not available at the time. So the question really came to us was that, but we were seeing a kind of a convergence of reports from all the different sites. And these were indicating that one, there was either reduced access, the same access to illegal drugs, but they were more contaminated, or they were much weaker. And then we also heard from our partners that there was a dramatic reduction in services, at least initially. And so this was the challenge. We thought eventually we made the assessment that supplying timely information that could provide some hints as to what may be happening was better than providing no information, so that people could at least prepare or at least have a sense of what's going on and maybe mount the appropriate responses. Next slide, please. So this was our main kind of finding that came out of this. Disruptions to an already unpredictable illegal drug market coupled with reduced access to direct services could pose significant health risks to people who use substances. This was where we took a risk, meaning that we came out with this report or this alert, and we didn't at the time have strong corroborating evidence, but we had many anecdotal reports from people who use drugs, as well as people working in drug checking and people working in harm reduction and law enforcement. Next slide, please. These are some further information, next slide please, that some kind of pieces out of the bulletin that we released that may be of interest to some of you. But really, when we look at the summary of the circumstances, really that we found that the reports were suggesting people that were using drugs that were more toxic, people couldn't access or afford their regular supply, and they may have reduced tolerance to involuntary or voluntary abstinence. People were using in isolation, which goes against a lot of the public health guidelines that had come out, and suggestions for people who use drugs to not use alone, to use in the presence of other people, to have naloxone handy, to try a little bit first, before using the full amount. These are all things that many argue, and there's some data to show that may have been trying to help kind of reduce some of the harms associated with at least opioid use. But we also found there were fewer direct services available. So this was going on at the same time that we found that if open, they were facing capacity issues. And so a lot of these services that I list here had reduced capacity. Next slide, please. And soon after we released the alert, we did start seeing the data come in that really were unfortunately corroborating what we had warned of in our alert. We saw drug poisoning reports increase. There were 3 alerts from Toronto in March, April, May. There were, in May 21st, the province of British Columbia did an overdose alert. And in April, the coroner's data, there was 117 drug toxicity deaths, a 39% increase over April of last year. So these were, this is unfortunate. Next slide. And here are the graphs over the time. And as you can see, at least in BC, there was some there was some progress being made. The number of drug toxicity deaths were decreasing, and you can see right there at the very end how they were very much shooting up. Some of the early data we have also is corroborated from Toronto. Next slide, please. And this we see in March and April, the number of fatal suspected overdose calls received by Toronto Paramedic Services has shot up. So next slide, please. So the kind of possible response options that we have talked about and discussed in some of our alerts is really access to a more reliable and safer drug supply. Health Canada has provided some exemptions to facilitate prescribing and providing controlled substances, better access to harm reduction services and tools, and access to virtual care and harm reduction options. Next slide, please. So those are my slides, and with that, I will release the mic and hand it over to my colleague, Dr. Cnferencia, to talk about the legal drugs in Canada, and then we look forward to your questions at the end of the presentation. Thank you.
Muchas gracias, Matthew. Con ustedes, Catherine Paradis, analista senior de investigación y políticas del Centro Canadiense sobre Uso de Sustancias y Adicción.
Good morning, good afternoon, depending where you are in the world. So my name is Cnferencia Paradis, Senior Research and Policy Analyst at the Canadian Centre on Substance Use and Addiction. Let's move to the next slide, please. So today, in a very short 15 minutes, I will present to you some results of polls and surveys about legal substance use that our organization has been conducting since the onset of the pandemic. This presentation could be defined as a scoop or rather a trailer. Indeed, we have only scratched the surface of these databases. As researchers, therefore, we feel it is important to let you know that these results are preliminaries, and that as we dig deeper, a complementary picture may emerge. Next slide, please. Next slide. So first, just to let you know, why have we been collecting data since the onset of the pandemic? So at the Canadian Centre on Substance Use and Addiction, we really pride ourselves to use evidence to inform Canadians. And so since the beginning of the pandemic, we have developed resources to inform Canadians and provide them with tips and advices regarding substance use during a lockdown. We have developed resources in collaboration with other organizations like the Mental Health Commission of Canada, who were well positioned to support Canadians in this period of uncertainties. We have also developed resources to inform stakeholders, including regulators and policymakers, and stimulate dialogue between Canadians and stakeholders. So all of these resources are available on our website, and I would invite you to go and download some of those if they can be of any use to you. So next slide, please. Next slide. So our first poll was conducted by a survey firm in Canada, Nanos, between March 30th and April 2nd, 2020. A total of 1,036 Canadians adults were randomly recruited by telephone and online. The sample was geographically stratified to be representative of Canada. And the first survey asked questions about cannabis and alcohol. And here is what we found. Next slide, please. So for cannabis, 9 in 10 Canadians who reported staying home more reported their cannabis consumption had stayed the same, while 6% reported it had increased and 4% reported that their cannabis consumption had decreased. Just to remind everyone that in Canada now, recreational cannabis is now illegal. So one result of significance is that Canadians between 18 to 34 years of age were more likely to report their consumption had increased than older Canadians. So it was about 14% of younger Canadians who said that they consume more cannabis since the onset of COVID. Next slide, please. So for alcohol, we slightly more unstable, but really nothing major. So 7 in 10 Canadians who reported that they were staying home more due to coronavirus indicated that their alcohol consumption had stayed the same, while 18% reported it had increased and 12% reported their alcohol consumption had in fact decreased since the onset of the pandemic. So this means that in the first weeks of the pandemic, the proportions of Canadians staying more at home and who reported that their alcohol use was about the same or less was 82%. Canadians, older Canadians, so 55 plus, were less likely to report that their alcohol consumption had increased than the younger Canadians, so those age less than 55 years old. I should also mention that we never found any gender differences in those initial results. Next slide, please. So we were really curious about the reason why there might be changes in patterns of use. And so when asked why their alcohol consumption had increased, Canadians reported that those who said that they had been drinking more often mentioned that it was because of a lack of a regular schedule, boredom, and stress were the main reasons why it had increased. This was followed by loneliness, and 12% reported that they had a lot at home, that it was available to them, so they were drinking more. A result of significance to us was that women were significantly more likely to cite stress as a reason for consuming more than men, while men were more likely to cite boredom as their main reason for consuming more since the onset of the pandemic. Next slide, please. Asked why their alcohol consumption had decreased, Canadians most often indicated a lack of social gathering opportunities to socialize, followed by health. People were saying, I want to keep my health up in case I get the virus. 12% had no reason why, and a few said that they didn't have much left at home, or they were too busy or caring for dependents. Women were more likely than men to cite being too busy to drink alcohol or not having enough left at home. They cited 24% of women cited that compared to only 4% of men. Next slide, please. So a month later, so at the end of May, between May 26 and May 28, we conducted a second nanos poll with a sample of 1,009 Canadians. This time we decided to focus on alcohol only, given that the previous poll had shown very little movement on the cannabis front. So the first good news that we got was that once again, the proportion of Canadians staying more at home who reported that their alcohol use was about the same or less was 80%. It was 82% in March. So we were not observing the significant increase that most of us in the field had been scared of. So my colleague Matthew previously told you that when it came to illegal drugs, they had posited the hypothesis that there would be an increase, and sadly that happened. Well, this was not the case for alcohol. So let's move to the next slide and look a little bit more into detail about Canadians' patterns of use. How were they using? So ask how their alcohol consumption since the beginning of May compares to the month of April. 77% of Canadians said that their alcohol consumption was about the same, while 40% said they consume alcohol less often, and 9% said that they were consuming more often. So this was really for the change in frequency. And again, only 14% reporting, only 9%, sorry, reporting to consume more often. And once again, there were no gender differences. Next slide, please. The next slide shows, focuses on the quantity of alcohol that they were consuming in May compared to in April. Next slide, please. Well, again, I think that it's because the results are exactly the same. When we asked them about their quantity, 70% again of Canadians said that it was the same. Only 14% said that they were drinking, 14% said they were drinking less per occasion, and only 9% said that they were drinking in larger quantities. So Canadians are very few to have reported an increase between the month of May and the month of April, or the beginning of the pandemic for that matter. And this is very good news, and it may be a testament to some of the prevention work that has been done in Canada. But does that make Canadians' patterns of alcohol use non-risky? Well, let's check that. And so let's move to next slide, please. Next slide, please. Okay, so with regards to frequency, Canadians staying at home and drinking alcohol most frequently say that they use alcohol 2 to 3 times a week, followed by 21% who say that they drink once a day. So 1 Canadian in 5th consume alcohol every single day. 18% said that they were drinking 4 to 5 times a week, and 10% said they drink 2 to 3 times a month. So again, there were no gender differences. And so only by looking at the frequency of drinking, we know that about 20% of Canadians do not currently follow Canada's low-risk drinking guidelines. So just to open a parenthesis here, in Canada, we do have low-risk drinking guidelines, and according to those, people should never drink more than 5 times a week. Women should never take more than 2 drinks per occasion. Men should never take more than 3 drinks per occasion. And so with that in mind, let's move to the next slide. So I told you that for women, it's no more than 2 drinks per occasion, and for men, the guideline is no more than 3. Well, what we see is that on average, since the beginning of May, men were reporting 2.8 drinks on the days they were drinking, and women 2.4 drinks. So that means that 12% of men, also 12% of men reported having 5 or more drinks on occasion, and 12% of women reported having 4 or more drinks, so exceeding what we define as excessive drinking. So all in all, this tells us that 12% of Canadians who use alcohol currently do not follow the low-risk drinking guidelines to reduce short-term harms like injuries and accidents. Women are really of concern here because their average number of drinks exceeds the low-risk drinking guidelines also for long-term harm. So it is with that in mind that we analyzed the result of a larger national survey conducted at the end of April. And let's move to the next slide, please. So again, with a concern for women in mind, CCSA commissioned another survey firm to conduct a large national survey about the pandemic and substance use. And this time, a total of 2,101 Canadians were randomly recruited from an online panel. The online panel platform ensured that the recruited sample was again geographically representative of the Canadian population. And the survey aimed to assess Canadians' cannabis and alcohol patterns of use, also their gambling patterns, as well as the methods of supply, how they were getting cannabis and alcohol before and since the onset of the pandemic. To uncover possible explanatory mechanisms between the pandemic, gambling, cannabis, and alcohol use, the survey this time really focused on psychological risk factors and social environmental risk factors related to the COVID-19 pandemic. The survey also gathered the opinions of Canadians on the designations of casinos, cannabis, and liquor stores in Canada as essential services. I know that this has been a topic that has been extensively talked about around the world, whether liquor stores should be deemed essential services. So next slide, please. So here's a snapshot of changes in reported behaviors. So the lines in black represent how people were drinking before the pandemic, while the color ones present data since the onset of COVID. So when it comes to how much people are drinking, it's about the same. Men report a slightly higher number of drinks per occasion, but for women it was the same, and overall population also no significant changes. Next slide, please. When we look at the frequency of gambling, cannabis, and alcohol, we see that for cannabis, the middle bars, there were absolutely no changes. With alcohol, women appear to be drinking a little bit more frequently, but that being said, that was not significant. The only significant changes that we saw were related to gambling, and that would not be surprising given that all casinos have been closed since the onset of the pandemic, and that in some provinces it was not even possible to purchase lottery tickets. That being said, our concern here, and the reason why we ask questions about gambling, is that we thought that many Canadians would then perhaps turn to online gambling. But as we can see from those data, it doesn't seem to, this fear does not seem to have materialized. Next slide, please. Yeah, these are, next slide, please. This is just a different way of presenting those same data. We also this time looked at the proportions of Canadians that were drinking within the lowest drinking guidelines before and since the COVID. And again, I have to admit that our biggest surprise is not so much the increase since the onset of COVID. In fact, there's been no significant increase in the proportions of people who exceed the lowest drinking guidelines, but rather the fact that it's always about a third of Canadians that are currently putting their long-term health at risk by drinking too much. That was true before the pandemic, and it is still true now. Next slide, please. Yeah, so just a few words before moving into more explanatory mechanisms to the result we just saw. I wanted to share with you data from another source. We are collecting in a small town in Canada, in the French province of Quebec, where since 2016 we have been collecting data about Canadians being admitted to the emergency room for an alcohol-related medical emergency. And in a time when mental health issues are more salient, but bars and parties are being canceled, we are seeing that the number of youth entering the emergency department for acute intoxication is in fact much down. To those working to reduce harms associated with too much drinking, this is really an indicator that a strategy to target high-risk contacts and to focus on alcohol availability, just like the WHO recommends, is probably a valid decision and the right way to go when it comes to reducing alcohol-related harm. Next slide, please. Next slide. I'll go very quickly through these slides because I see that my time is up, and I just wanted to share with you again, these are the preliminary analysis, and we've been seeing that when we look at the way Canadians have been experiencing negative emotions and their substance use, so substance use meaning alcohol, gambling, cannabis altogether, we see that those who experience the most negative emotions are those who report also also the greatest increase in substance use. Next slide, please. We also see that those who experience more social interactions have also been using more. And so this is a result that was surprising to us. How can people have more social interaction in a time of lockdown? Well, it appears that in neighborhoods, people were organizing dinners outside together, and that led to more substance use. So really a clear relationship between the number of interactions and substance use. Next slide, please. This is another type of analysis where we saw that we performed and saw that when we were asking people about their perceived change in alcohol use, as I've been showing since the beginning of the presentation, there's literally been no changes when it comes to patterns of use. But people really think that everyone else is drinking more. And so there's a significant difference between perception and actual behaviors in Canada. Next slide, please. And finally, I just want to show you a couple of slides about public opinion. So as I mentioned at the beginning of this presentation, so in Canada, right at the onset of the pandemic, both cannabis stores and alcohol liquor stores were declared essential service. Now, when we ask people how justified it was to designate cannabis store and essential services, we see that there was not much support for that. Most Canadians were, so about 46% of Canadians were very cold to this idea that it should be, that it was a justified choice. Next slide, please. Same thing for the importance. More than half of Canadians were really cold to this idea that it was important to keep a cannabis store open. They didn't think so at all. So in this case, the politicians' decision was not aligned with Canadians' attitudes. But let's take a look at the alcohol slides. Next slide, please. So this is really what I find to be a politician nightmares. When Canadians were asked how justified it was to designate liquor store essential, we see that Canadians are really split across the board. It's about 20% of Canadians who are very cold to the ID, 20% very warm to the ID, and same proportions in between. So there was no right or no wrong here. Canadians are split on this ID. And it's the same thing for how important it was to keep alcohol liquor stores open. If we go to the next slide. So you see here again, well, about a third didn't feel it was important, but still there was a significant proportion of Canadians who thought it was very important to keep the stores open. Next slide, please. Next slide. Yeah, so this is just, so this is the end of my presentation for today. As I mentioned, it was really just a trailer. We will continue to analyze those data with two things in mind. The realization that pandemic or not, there's about a third of Canadians who probably use alcohol too much. The pandemic does not seem to have had an impact on either cannabis or alcohol use, and there's a slight concern for women that we will want to dig deeper into. Thank you very much.
Muchas gracias a nuestros colegas de Canadá, a Matthew y a Catherine. Antes de avanzar, me gustaría disculparnos por los problemas técnicos que tuvimos durante las palabras de Jimena Kalowski. Sabemos que no hubo traducción simultánea en ese momento, por eso estamos trabajando para subirlas tanto a la sección de documentos como a nuestra página web del Observatorio Interamericano sobre Drogas. Pueden ver la dirección a través del chat, ahí yo la posteé. Y bueno, ahora seguimos con ustedes Jorge Villatoro, coordinador de la Unidad de Encuestas y Análisis de Datos del Instituto Nacional de Psiquiatría Ramón de la Fuente Muñiz de México. Esperamos que el señor Jorge prenda su cámara y su micrófono.
Gracias, buenos días a todos.
Buenos días.
Pues muchas gracias por la invitación a todo la OEA CICAD, al señor embajador. Realmente es un gusto estar con ustedes aquí. Y bueno, vamos a presentar en este caso una serie de datos relacionados con qué es lo que está pasando en México en relación con esto, dadas las distintas fuentes con las cuales contamos en este momento, lo cual en buena medida es muy similar a los aspectos que maneja Canadá, aunque los sistemas evidentemente que son bastante diferentes. No sé si en este momento ya se ve mi presentación. ¿Me podrían decir si ya la ven? Ok. Bueno, quisiera comentarles entonces, este es un trabajo que se emprendió con varias personas del Instituto, de la CONADIC, de Prevencasa, particularmente, están aquí mencionadas. A todos ellos les agradezco lo que hayan ustedes apoyado para la realización de esto. Muchísimas gracias. Entonces, comencemos con los datos. El objetivo entonces es ver cómo estuvo la disponibilidad y también la parte de atención del consumo de drogas en el país conforme distintas fuentes y algunos, incluso entrevistas directas con algunos de los estados y situaciones del país. Primero, ¿qué pasa con esta parte de los costos, ¿no? De los productos de alcohol directamente? Vemos como la parte de las cervezas, el whisky, el brandy y el tequila, aquí vemos claramente señalados como han incrementado. Esta es información de Nielsen México directamente. Y también tenemos datos de parte de lo que sería el INEGI, en donde vemos estos incrementos en relación al mes anterior, en relación al año anterior. Y vemos cómo hay un aumento bastante importante del 11.19% en estas bebidas directamente. Aquí hay que tomar en cuenta que, bueno, en México, en diversos estados, se declaró lo que es la ley seca, ¿no? Por lo cual no había disponibilidad de alcohol en algunos de estos estados, en algunos de los municipios del país o counties. De manera tal que, bueno, esto fue bastante disímil conforme a cada uno de los estados. Algunos fue durante todo el tiempo, otros fue nada más durante los fines de semana. Actualmente incluso todavía esto está instalado en algunos de los, por ejemplo, de lo que serían las alcaldías de la Ciudad de México. Entonces, en este contexto donde tenemos una situación de aumentos, una de las fuentes que utilizamos fue lo de CISBEA, del CINAVE, que es el Sistema de Vigilancia Epidemiológica de la Dirección General de Epidemiología, y vemos aquí los datos comparados de 2020 contra 2019 y divididos por 3 fases del año, ¿no? La primera es antes de que se diera el primer caso de COVID en México, que fue a finales de febrero. La segunda es donde ya empezamos a tener casos de COVID y todavía no estábamos en confinamiento, y ya después son las semanas en las que se estuvo de confinamiento en el país. Y vemos aquí claramente cómo pues se han registrado menos intoxicaciones agudas por alcohol. De hecho, pues, prácticamente estamos viendo que es la mitad de las que se tenían en el año anterior. Adicional a esto, tenemos también reportes de los más de 20,000 servicios donde se atienden a las personas, que también la parte de que hayan llegado pacientes por enfermedad alcohólica del hígado, pues también hay una reducción importante, ¿no? Durante un poco leve antes del confinamiento, y ya durante el confinamiento pues vemos que llegaron muchos menos, ¿no? Igual en el caso de casos de cirrosis hepática alcohólica, vemos que hay una cantidad mucho menor. Aquí hay una hipótesis, dada las conversaciones que tuvimos con algunas de las personas en los estados, en donde, digamos, se dejó de alimentar, por ejemplo, algunos datos como fueron el CISBEA, que es el Sistema de Vigilancia Epidemiológica de México. Se dejaron de alimentar lo que era toda esta parte de los reportes de los centros de tratamiento, porque, bueno, la gente se fue a sus casas, por un lado, y por otro lado, algunos de los UNAMCAPAS del país y los centros, pues también cerraron o cambiaron sus actividades para apoyar lo que sería la parte de la pandemia. Y encontramos, o sea, en ese sentido, pues sí, la pregunta era que si estos decrementos no se debían más a una cuestión de falta de registro que otra cosa. Y lo que encontramos, por ejemplo, bueno, aquí también está el reporte de lesionados por accidente y también los accidentes propiamente de transporte, donde vemos que son muchos menos. Y la parte de chequeo, pues vimos el indicador del dengue, que si bien no tiene que ver con esto, sí nos estaba dando una idea de si se estaba registrando o no. Y lo que vimos originalmente es que en el 2020 había menos casos, aunque todo un tiempo se mantuvo bastante similar, pero en el dengue grave vemos claramente también como hay un número importante, sobre todo antes del confinamiento, ¿no? Todo esto nos hace suponer que sí hubo una buena recolección de datos, sin embargo, evidentemente que esto lo podemos confirmar ya una vez que se normalicen, entre comillas, las actividades y veamos si estos registros no se actualizan y entonces vemos que a lo mejor estas partes de lo que serían los accidentes y demás, pues nos estén llevando a un subregistro. También es importante mencionar que, bueno, otro factor que está apoyando aquí esto, que no haya habido tantos accidentes, pues es obviamente que la gente estuvo en confinamiento, ¿no? Entonces, viéndonos hacia la hipótesis ya de lo que sería, ¿qué otros indicadores hay? Pues bueno, justo lo que observamos es una gran cantidad de intoxicaciones por ingerir bebidas alcohólicas adulteradas, ¿no? En varias partes del país. Aproximadamente esto se actualizó hacia el 3 de junio, pero hemos visto que todavía hay algunos casos más, casi se llegan a 200 muertes. De manera particular, pues los más afectados son Jalisco como número de intoxicados, pero en Puebla tenemos una gran cantidad de lo que serían fallecimientos por intoxicación. Parte de lo que todavía estamos trabajando es ver cómo estaba este panorama el año pasado para ver si hubo una modificación o no, pero realmente sí ha sido un problema importante. Estas intoxicaciones han sido por el consumo de metanol principalmente, que se los han mezclado, que se los han vendido como etanol en algunas partes, muy probablemente en partes rurales sobre todo, y que seguramente se los están vendiendo por la falta o la no disponibilidad de alcohol, ya que en México, a diferencia de lo que nos señalaron nuestros compañeros del Canadá, sí declaró que la producción de alcohol no era una actividad esencial y se disminuyó la producción y la disponibilidad de la sustancia. Adicionalmente, pues hay una buena cantidad de encuestas que se han hecho, afortunadamente. Esperemos que estas nos ayuden. Ya Pernell muy claramente nos ha señalado cuáles son las distintas limitaciones que se tienen sobre esta situación. Entonces, aquí justamente hay que tomar en cuenta esta parte de los datos. Sin embargo, sí nos da una indicación de cómo pueden estar la situación, y no solamente en México, sino también en otros países. Aquí no está anotada directamente la que realiza Canadá, sin embargo, es una de las que revisamos también para ver cómo está el contexto. Aquí vamos a dar algunos datos de México, unos datos que amablemente la doctora Marcela Tiburcio, la doctora Nora Martínez y su equipo me permitieron compartir, y que ya ha presentado ya sus datos iniciales. Este es un corte del 31 de mayo. Sin embargo, ya me parece que esta semana terminó el levantamiento y ya pronto tenemos los datos claros, ¿no? Y encontramos justo como los dos fenómenos. Si bien aquí están señalados los incrementos del consumo de alcohol, vemos que estos incrementos se dan particularmente en el consumo diario o casi diario, ¿no? Tanto en hombres como en mujeres. En las mujeres es donde vemos el incremento más alto, pero también del lado izquierdo vemos como la gente que nunca había consumido y que en este caso no consumió durante la pandemia también se incrementa de forma importante y disminuyen los patrones de una vez al mes o menos, o de 2 veces al mes o menos, y una vez por semana en el caso de los hombres, y en las mujeres hay un pequeño incremento. Entonces vemos que están ambos aspectos. Me parece que en este caso estamos apuntando hacia que hay más una disminución del consumo que el incremento, y donde se está dando este incremento pues es en el patrón de consumo diario. Adicionalmente al alcohol también está la parte del tabaco. Nuevamente observamos un patrón similar. en cuanto a la parte de la reducción del consumo en todos los casos, y en el caso específico de los hombres es muy pequeño el incremento que se da, apenas del 1.4%, y en las mujeres permanece prácticamente igual para lo que son los consumidores diarios o casi diarios, ¿no? Entonces esto es un elemento bastante importante, ¿no? En términos de cómo ha habido disminución de este consumo. Hay otra encuesta, una encuesta que llevó a cabo el Instituto Nacional de Salud Pública y que recientemente está disponible en Internet, que lideró la doctora Teresa Shaman. Y aquí vemos resultados bastante similares, ¿no? La gente, la prevalencia o, bueno, frecuencia en este caso, aunque es una encuesta, en realidad es una encuesta semiprobabilística, basada en este caso, la primera de Marcela fue hecha vía internet y en este caso es de llamadas telefónicas, pues encontramos que la mayoría está indicando que sus consumos son iguales, tanto para alcohol como para tabaco, y en este caso se encuentra que el 20.7% indica que es mayor su consumo y el 11.9% en el caso del alcohol, pero también tenemos que el 24% dicen que su consumo es menor y de alcohol es del 38.9%. En el caso de tabaco, únicamente ellos detectaron un caso de estar vapeando directamente y todos los demás casos de los consumidores son básicamente cigarrillos. Su muestra en este caso es de aproximadamente un poco más de 1,000 sujetos. Ese era su objetivo, tener una cuota de 1,000 sujetos, y estos son los datos que nos presentan. Aquí habría que encontrar las razones o en los resultados posteriores que sacan, si es que lo preguntan ambos estudios, saber cuáles son las razones por las cuales han decrementado o incrementado su consumo. Es bien interesante la parte de Canadá que nos acaban de presentar y en la parte donde el tener esa disponibilidad de que tenía mucho alcohol en la casa, ese 14% que ellos señalan, pues esas son gente que nos está diciendo que está aumentando o por esa razón está aumentando su consumo. En el caso de la marihuana también observamos una disminución, aunque en el caso de los hombres, en el patrón de consumo de diario casi diario es donde estamos encontrando un mayor incremento. En México, evidentemente, el consumo de marihuana, bueno, la distribución de la marihuana, la producción y demás todavía no es legal. Y entonces lo que se estaría haciendo en un momento determinado, y se cree que cómo se está consiguiendo la sustancia básicamente es a través de los servicios de entrega de alimentos y cosas por el estilo, ¿no? En cuanto a la parte de tranquilizantes, aquí observamos un ligero incremento en el caso de las mujeres en los patrones de 2 a 4 veces al mes y de una vez por semana. Estos incrementos son importantes porque una de las partes interesantes que haremos más adelante de esta encuesta cuando nos presenten sus resultados el equipo que la realiza, pues será ver la relación entre la ansiedad y el estado de ánimo de estas personas, la depresión, que son elementos que ellos están evaluando. Y de hecho ya presentaron algunos resultados donde se muestra propiamente que las personas con más nivel de depresión son aquellas que están consumiendo más. Entonces sí será muy interesante ver ya los datos finales, cómo queda esta parte y saber también quiénes son las personas que finalmente decidieron disminuir su consumo. Ojalá que podamos ver también el aspecto económico, porque puede ser el no tener recursos lo que también esté llevando a cabo a dicha abstinencia o disminución del consumo. Otro de los elementos, en México tenemos diversos servicios de llamada, tenemos la línea de ayuda del CONADIC, en este caso no lo incluí aquí, más que nada porque también está ahorita con todos los aspectos de salud mental, que es bastante importante y es seguramente donde se está incrementando, y junto con otros servicios han estado saturados, entonces se vuelve un poco complicado tener una especie de referente. Pero aquí la parte importante en esta línea de la Ciudad de México de manera específica, pues es ver cómo directamente el número de llamadas se ha mantenido constante, ¿no? Debido a las cuestiones de adicciones que pueden ser, hay varios elementos y habría después más adelante que poder depurar más la información, pero principalmente se deben a ayuda por el propio consumo. Y la parte que sí hay que señalar que es de manera súper importante es esta situación del incremento de violencia en los hogares, que pueden ser desde peleas entre los propios hermanos, pero la mayoría sin duda se están refiriendo a la violencia entre la pareja dentro de los hogares. Esto es un aspecto muy importante que también ha sido señalado directamente por Mujeres. Y Mujeres es el Instituto de Mujeres de la Ciudad de México, donde ellos dicen que han aumentado el 6% de las llamadas de emergencia por violencia. Me parece que probablemente sea mayor. Un poco este caso de violencia ellos también lo relacionan con la parte de que el crimen organizado está cooptando a más mujeres. De hecho, en México ahorita el crimen organizado también ha entregado despensas en la frontera, no solamente en Sinaloa. En la mañana me pasaron directamente un reportaje que acaba de salir, donde en Ciudad Juárez y en otras partes pues están entregando el crimen organizado, se organizan para pasarle a la población despensas y ayudarles en esta situación donde no están teniendo ingresos. Evidentemente habría que ver qué es lo que estaría pidiendo después el crimen organizado. Sin embargo, pues evidentemente está encontrando cierta empatía con este tipo de actividades. ¿Qué pasa con los usuarios de heroína en la frontera? Aquí hablaré de los usuarios de heroína en particular, pero también hablaré de aquellos usuarios que se encuentran en un momento determinado, pues, en situación de calle o que tienen un consumo problemático en algunas ocasiones. Parte de lo que estuve viendo es, pues, qué ha pasado con los servicios. Como comentaba inicialmente, pues la gente ha estado en sus casas, ha tratado de moverse estas partes de tratamiento a lo que serían directamente el dar atención telefónica, el dar atención por videollamadas a través de diferentes servicios de los propios teléfonos, como el propio WhatsApp o cosas por el estilo. Sin embargo, no toda la gente tiene acceso a esto y a no toda la gente le gusta esta clase de servicio, y es parte de lo que tenemos que trabajar justamente para que en una situación de esta los usuarios de más riesgo no queden desfavorecidos y puedan tener una atención importante. ¿Qué nos dicen la gente directamente? En este caso fue con diversas llamadas que tuve con la gente de la Asociación Civil de Prevencasa. Dicen, no hay desabasto de droga y no han observado mayor síndrome de abstinencia en una población específica del norte de la ciudad de Tijuana, ¿no? Nos indican que el costo de las dosis sigue siendo el mismo. Incluso en este caso, algo bien interesante, y vamos a ver también adelante porque lo que nos señalan es que cuando están en la situación de compra, si no tienen suficiente dinero, se les llegan hasta vender menos o incluso hasta fiarla para pagarla después. Esto porque también los narcomedistas son muy conscientes de que no están teniendo el acceso en su actividad cotidiana los usuarios que pues regularmente van a la parte de la basura, van a conseguir cosas, van a tratar de tener alguna actividad para tener un recurso, y pues con esto del confinamiento evidentemente que ya no se puede presentar. Entonces por parte de la gente que le está vendiendo la droga ha habido esta situación, lo cual es importante, y por ello también observamos que la droga sigue allí y que no hay un mayor síndrome de abstinencia. Otro aspecto importante es donde está la goma blanca, también se ha incrementado la presencia de goma negra y viene mezclada con fentanilo. Esto ha sido probado a través directamente del uso de tiras, ¿no? El uso de la goma negra es básicamente porque estos usuarios de manera particular mencionan que tiene mucho mejor sabor, así lo expresan ellos, y entonces el hecho de que tengan la goma negra mezclada con fentanilo, pues es algo que ellos aprovechan, y entonces ven que hay de las dos en los lugares de venta. Por eso mismo también vemos que no hay mucha movilidad de los usuarios a otros puntos de venta para comprar drogas. Los puntos más o menos siguen presentes ahí, los usuarios se siguen moviendo al respecto, y una parte interesante que están haciendo ahí es que antes, o sea, a finales del año pasado, a mediados del año pasado, sí estaba habiendo un poco de movimiento de los usuarios hacia otros lugares porque pensaban que la droga era mucho más fuerte, y es porque estaba mezclada con fentanilo. En este caso parece que el fentanilo ya está en todos los sitios de venta de drogas, lo cual es bastante complicado. Por otro lado, Los usuarios sí dicen que han aumentado el número de casos de sobredosis, eso es algo importante, pero básicamente ellos se refieren a que son nuevos usuarios, ¿no? Que están regresando migrantes de los Estados Unidos o porque están llegando y tratan de cruzar, y estos nuevos usuarios no están acostumbrados a la potencia de la droga porque en este caso ya está combinada con el fentanilo. ¿Qué más tenemos al respecto? Pues les ha sido difícil conseguir dinero, como mencionaba anteriormente, y eso también los ha llevado a ellos a que regularmente en el estudio de la doctora Clara Fleiss de Coqueando la Chiva, el libro está perfectamente disponible, ella mencionaba que el número de dosis más o menos promedio era de 5 veces al día para estos usuarios que se le inyectaban de 5 a 7 veces, y lo que estamos viendo aquí es prácticamente como si bien han tenido menos dosis, ellos lo están dosificando para tratar de evitar obviamente este síndrome de abstinencia porque no hay tanto dinero. Y en México se cerró la frontera con Estados Unidos y nada más hubo un intercambio, básicamente el sustancial, el de comercio, y esto pues ha evitado el que la naloxona que diversas organizaciones sociales de Estados Unidos han donado a las organizaciones de México en la frontera, de manera particular en Tijuana y cosas por el estilo, para que la puedan distribuir, entonces ha disminuido, no hay tanta naloxona disponible y eso es un riesgo que estamos viendo ahorita y que es muy importante tomar en cuenta porque pues es digamos lo que ayuda directamente para reducir o a poder luchar contra las sobredosis. De manera importante también hay que señalar que la naloxona en México es un producto que solamente se consigue con receta médica y es la versión inyectada, no es la versión nasal, que es mucho más buena y potente y funciona mejor para los casos de sobredosis de fentanilo. Y entonces lo que estamos viendo pues es aquí una cosa que tenemos que cambiar a nivel de país y es luchar fuertemente porque la naloxona esté disponible, al igual que, por ejemplo, lo que sería otros sistemas alternativos para tratar a los usuarios, particularmente cuando están en confinamiento, ¿no? Como puede ser la metadona. En una experiencia que se tuvo en este tiempo y que dirigió la doctora Clara Fleiss para que en un albergue se tuviera de COVID, se tuviera para los usuarios la disponibilidad de la naloxona, fue un problema bastante fuerte. Ella junto con otra gente de lo que es Prueba en Casa, incluso la gente de la jurisdicción, trabajó muy fuerte, pero se necesitan permisos de COPEPRIS, que es la agencia reguladora de este tipo de situaciones en el país, y se complicó la situación y no fue posible tener este servicio. Porque en general lo que es la metadona está bastante lejos de donde se encuentran los usuarios, entonces los usuarios prefieren no ir, y en una situación de un usuario que llega a presentar COVID, pues está confinado y además se agregan entonces todos los síntomas relacionados con lo que sería el síndrome de abstinencia. Desde hace tiempo ha crecido la violencia, esto no ha decrementado aún en estas situaciones, particularmente en el canal, que es la parte ya propiamente que divide México a Estados Unidos, donde los distintos carteles están disputando el territorio. Es decir, en este tiempo aún se siguen viendo este tipo de situaciones, no solo en Tijuana, sino en muchos puntos del país, desafortunadamente. Es importante señalar que sí se han presentado muy pocos casos de COVID en esta población, no más de los que se han presentado en la población general. De hecho, esto es algo que estábamos muy preocupados de que no fuera a haber altos casos. Esto incluso ha llevado a que diversas personas, entre ellas el doctor Carlos Magis, están realizando o van a realizar, y sería muy importante realizar estudios sobre la gente que en un momento determinado está en esta situación y por qué no han sido ellos tan vulnerables al COVID a pesar de todas las condiciones en las cuales están viviendo. Me parece que estudios de metabólicos y cosas por el estilo son muy importantes para saber qué es lo que está pasando al respecto en esta población que afortunadamente no ha sido tan afectada por la pandemia. ¿Qué nos dice la parte de la Oficina de Drogas y Delitos? Sabemos que en días pasados se presentó el informe y antes de ello hubo algunos reportes periodísticos que se presentan al respecto, que son parte de lo que mencionamos aquí, ¿no? Nos han mencionado que hay un mayor consumo de drogas debido a la sobreoferta, a menor precio por una reducción de la demanda. Esto probablemente se pueda llegar más adelante y una vez que tal vez la gente salga, va a haber una gran cantidad de droga. De hecho, en uno de los puntos más adelante, parte de lo que tenemos es que en la frontera norte se indica, como es la parte de abajo de mi lámina, y esto lo señaló directamente Sofía Díaz Menció y en su presentación del reporte de drogas en México, y fue antes señalado en otros medios y presentaciones, pues que el norte del país parece ser que se está convirtiendo en un gran almacén de drogas, ¿no? Esto visto a través de drones, justamente por esta parte donde se cerró la frontera y no está pasando, y entonces justamente como mencionamos en los puntos anteriores, pues la movilidad vía marítima es la que se ha convertido como más fuerte. De hecho, toda la parte del tránsito de drogas se está yendo hacia Europa a través de esta vía directamente en lo que serían envíos mucho más grandes a uno de los puertos de Europa que todavía no logro identificar. Al parecer, parecerá ser que es Amberes, no estamos seguros de esto. Estamos checando lo que es un informe reciente que salió de la Unión Europea y al parecer sería Amberes donde está llegando la mayor parte de este tráfico de sustancias, pero necesitamos revisarlo, ¿no? Y otro de los aspectos que se están trabajando ahorita y, bueno, que venían trabajándose desde antes, era esta situación de que los cárteles mexicanos ya no solamente están trayendo los insumos que se cortaron completamente durante la pandemia de parte de China, porque justamente donde se inició la pandemia en Wuhan es donde se producen estos precursores. Entonces lo que están intentando ahorita los cárteles mexicanos pues es justamente producir ya fentanilo directamente para no depender de los insumos de China, y esto en parte se puede ver en los distintos reportajes que hizo Penilei Ramírez de Univisión Informa, que están muy interesantes, donde incluso se pudo meter a los lugares en donde se está llevando a cabo la cocinada de la sustancia directamente para producir el fentanilo y combinarlo con heroína en lo que sería la parte de Sinaloa de nuestro país, en el Pacífico, un poco antes de llegar a lo que sería el Mar de Cortés. En este sentido, bueno, pues ¿a dónde llegamos o cuáles serían los puntos importantes? Se han manejado mensajes a través de redes sociales de manera importante sobre, principalmente, acerca de invitar a la población para no consumir alcohol, tabaco y otras drogas. Es un trabajo muy interesante que han hecho sobre todo el maestro Arturo Sabines y Norberto Hernández en ese contexto, donde se han hecho una serie de documentos que se le trata de pasar a la población. Ya de hecho, sobre esta parte de lo que fueron las intoxicaciones por alcohol, se ha hecho una campaña que debería de tener, desde mi punto de vista, un poquitito de mayor difusión en medios para decirle a la gente de que se detecten automáticamente cuáles son los síntomas derivados de consumir alcohol adulterado y de cómo evitar conseguir alcohol adulterado en la población. Entonces, esto se tiene que hacer evidentemente de manera regular, hacerlo de una manera más sencilla, con mensajes más claros para la población y que estén para la población, y también que se trabaje con autoridades locales con objeto de poder conocer más la comunidad y que ellos puedan ayudarnos a mandar mejores mensajes. Eso me parece bastante importante y qué bueno que se está haciendo la campaña. Esperemos darle mayor publicidad y que se puedan dar mensajes más específicos. Otro de los aspectos que señaló la persona que presentó los datos del Informe Mundial de Drogas es: hay que pegarle a las finanzas de los grupos delictivos. Eso es algo súper importante para disminuir la oferta de drogas. Esto sabemos que se están sacando cada vez más nuevas sustancias, y el pegarle a esta parte de las finanzas pues va a hacer que evidentemente haya menos productos disponibles en los distintos países. Y también algo muy importante aquí es evidentemente trabajar mucho con la capacitación de las policías, trabajar mucho con la parte de la corrupción para que no sean, digamos, corrompidas por la parte de lo que serían los cárteles. Eso es algo muy importante, incluso a nivel de prevención es muy importante mencionar que muchas veces hacen programas de prevención, pero fuera de las escuelas o en la comunidad donde se está aplicando, pues la gente está vendiendo la droga y no tenemos un apoyo directo de lo que serían las policías que están disponibles, porque muchas veces están coludidas con estos grupos. ¿Qué más? Algo de lo que hemos olvidado, creo yo, en la política que se está haciendo en el país es que la gente que presenta dependencia a las drogas y la gente que tiene problemas de drogas, con este cierre de servicios, pues ha dejado de tener apoyos disponibles, ¿no? Entonces, muchas veces con la saturación de las líneas de ayuda, pues estas personas, las que pueden llamar, pues están ahí y la gente que está en situación de calle se vuelve súper complicado, no hay servicios. En México, desafortunadamente, aún no tenemos disponibles lo que serían las salas de consumo seguro, y esa debería de ser uno de los aspectos que tenemos que trabajar. Y no solamente pensar en las salas de consumo seguro, donde Canadá tiene un muy buen sistema, sino hay que pensar en esas salas en caso de que haya estas situaciones de emergencia, cómo podemos ayudar a los distintos usuarios y cómo podemos adaptar esa idea también para poderles servicios de salud en general en caso de pandemias como es esto, ¿no? Y estar preparados para que los ayudemos con los problemas que tienen. Y esto obviamente desde una visión de política pública de salud ante esta situación y no tanto de estar criminalizando a los usuarios, que es algo que afortunadamente está cambiando. Me parece que esto, aunque tenemos esas líneas de ayudas y demás, no todas las poblaciones tienen acceso al celular o la computadora y muchos están en situación de calle, más bien lo que buscan es encontrar los recursos para poderse hacer de su sustancia. En Ciudad de México sí se hizo un trabajo interesante donde se trabajó con las poblaciones que viven en situación de calle para poderlas ayudar y estarlas checando constantemente con objeto de que no haya problemas de COVID en esta población. No he visto hasta ahorita, y estamos en la indagación de esta información, de cuáles han sido los resultados de lo que intervino la Ciudad de México con esta población, ¿sí? Y bueno, pues no hay recursos económicos, no hay apoyo. Las organizaciones civiles de este país que han hecho tan buen trabajo, entre ellos quienes me ayudaron de Prevencasa, Verter, de lo que sería Mexicali, compañeros y muchas otras que están trabajando en el país, pues no se les está dando recursos y es bien importante que puedan tener recursos, que se pueda trabajar directamente con estas asociaciones, que se vea directamente y de manera transparente el uso de estos recursos para que puedan hacer ese trabajo que me parece que desde el gobierno no se está realizando. En fin, esto es, digamos, lo que quería compartir con ustedes. Agradezco muchísimo su atención.
Muchísimas gracias, Jorge, y muchas gracias a todos los ponentes. Le paso la palabra a Pernell Clark, quien moderará el espacio de preguntas y de respuestas.
Thank you very much, Paula. I'd like to ask Matthew, Catherine, and Jorge to request the floor, please, so that we can put the questions directly to you. And while we do that, as all of you can see, we are out of time. We are in overtime right now, actually. So we're going to try to limit the question and answer session for the next 15 to 20 minutes. So I'm going to ask the presenters to please keep your responses very short, succinct, and to the point. So what I will do is I'll take the questions that have come in and I will group them by presenter. So Matthew, since you're on, I'm going to send the first set of questions to you. I'm going to give you all of the questions and then you can make a note of them and respond in short time, please. So the first question for you, Matthew, is from Livia Lopez, who was wondering whether in any of the work that you've done with Sisendo and your stakeholders, do you do wastewater analysis in any of your studies? That's a question from Livia. Hector Sevilla from CFATF reference slide number 30. I think that was in the group of slides that you presented. He wants to know, or wants you to explain what you mean when you said disturbances, and I'll quote here, disturbances in an already unpredictable illegal drug market, coupled with reduced access to direct services, could present significant risks to the health of people who use substances. He wants to know if you can explain that a little more. And then the last question actually comes from me, Matthew, if you could in a couple minutes just tell us a little bit more, well, in a nutshell, about CICAD, how it works, and how you use it as an early warning mechanism. I know you mentioned it briefly in your presentation and we didn't have a lot of time, but I think it's important for the participants to hear a little bit about how you actually use CICAD as an early warning mechanism. I hope those questions were clear. Matthew, the floor is yours.
Okay, well, thank you for your questions. First, the question about wastewater analysis. We do, there has been some studies that have been done by Statistics Canada. We've not had an opportunity to collaborate with them enough to incorporate them into some of the work that we are doing. It was initially done to examine cannabis consumption levels, I believe, in response to legalization, but that is something that we have chatted with them about, and we're going to pursue that. For disturbances to an already unpredictable illegal drug market coupled with a reduction in direct services. So to explain that, so I presented that how it's difficult to do a complete analysis to know how much variance is accounted for, but a very large amount of the harms associated with taking illegal drugs is associated with the unpredictability of what is included in the drugs. So we know that even though people have, people know that there's fentanyl in the drugs now, they don't know in what quantity, and they don't know, so they don't really know the toxicity of the drugs that they're using. In addition, there are changes even within purchases. So from one purchase to the next with the same dealer, there's a huge variability. So that unpredictability elevates the risk to the person who uses or who buys those drugs. Further, we also saw increasing unpredictability in the lead up to COVID-19, and we saw the introduction of benzodiazepines being included in the opioid supply. And we also saw some synthetic cannabinoids, and whether or not we don't know whether or not they're placed there intentionally or unintentionally. But all of these, this unpredictability increases risk to the person using. Now, if you combine that unpredictability, and that unpredictability seems to have increased after the onset of COVID. You combine that now with a lack of direct services, and by direct services, I mean treatment, I mean harm reduction services, needle exchanges, supervised consumption facilities, drug checking services, just like homeless shelters even. Like all those things, you combine those two things together and it's an incredibly toxic mix. And we were very concerned about that. And unfortunately, some of the early data are corroborating our concern. So that's what that means by that that piece, and I'd be happy to chat further with you if you feel like contacting me offline. So yes, in terms of CNFERencia is a program or a network that we've had established for about since about 1995. It's gone through fits and starts, but really since about 2012, it's been operating steadily, and I could go on I won't go on too long about it, but I think it's one of the things that I think is quite effective about it is that, so essentially we have communities across Canada that and each community is encouraged to forge relationships with people who have direct experience, either by people who use drugs or people who provide these direct services to people who use drugs, including law enforcement and other people. So, and as well as data holders, so local coroners, local medical examiners. So these, at the community level, we encourage the nurturing of those relationships, and then those can act as sentinel sites. So we can see, it's not a national picture, but by having a series of sentinel sites from around Canada, we get a sense of what's happening within the drug situation. oftentimes these sites don't necessarily are not necessarily able to early on present data that we can provide, but a lot of those anecdotal reports, especially if they converge, are a really great early warning signal about what's happening. We saw that with fentanyl early on. We didn't have data to support the addition of fentanyl into the illegal drug supply, but we had lots of anecdotal reports that were eventually corroborated with data. CNDU, we put out a first alert on illicit fentanyl in illegal drugs in 2013. So this was many years before we truly started seeing the mounting death toll, but it was those reports. Now, they need to be corroborated with data. And then finally, I might just say, Pernell, that I think that one of the nice things about CNDU is it's almost entirely a volunteer-based network. It's a grassroots network, and CCSA spends very little money operating the network, so it's very low cost. And so I think that the functionality of it, I could provide more information if you like, but I do think that we're very proud of the network, and we think we're still growing it. But yeah, I'll leave it at that because I know we're short on time.
Thank you very much, Matthew. No, those responses were spot on, and Hector actually sends his thanks for the response on the question that I asked about disturbances in the market. So I'm going to move on to Catherine. Yes, I see Catherine appearing. First of all, let me thank Matthew, Catherine. I forgot to do this. Matthew, Catherine, and Jorge. Those were 3 excellent presentations. Lots of data, lots of information. Thank you very much. So for you, Catherine, a couple questions. We have Graciela Umara, who is asking a very specific question. She wants to know whether excessive or risky consumption actually increased in terms of alcohol use. Maria was asking about the differences by gender for the increase in alcohol use. So are the reasons between men and women different for why they would have increased their alcohol consumption? And also, let's see, there's one more question. No, that's it. So the focus on gender, and I think in the wrap up to your presentations, Catherine, you also mentioned that this is something that we need to follow up on. So can you speak a little bit more about the influence of gender and specifically on excessive or risky consumption? Thank you, Catherine.
Absolutely. Thank you very much for inviting me to speak to your group today, and thank you for those questions. So with regard to excessive or risky consumption, no, we did not see a significant increase since the onset of COVID. As I mentioned, we were concerned. We thought that there would be an increase, people being at home without a routine, feeling anxious, but in fact, we didn't see a significant one. When it comes to the second question regarding gender differences, there's been no gender differences besides the one that I specifically mentioned in the presentation. So when it was significant, I did mention it, and that was regarding reasons to drink. So by heart, I think that we saw that women who were staying more at home and who reported an increase in their alcohol use, it was mainly because of stress and anxiety, while men had a different set of reasons. It was more boredom and loneliness. So differences in the reasons why there were an increase. But again, we will keep our eyes on women, and we will dig deeper on those data, because when it comes to the quantity they use per occasion, it is high. It is high according to Canadian standards, and it follows a trend that we've been seeing in our country now for about 5-6 years, where more and more women, especially young women, drink more and larger quantities. So we want to get a better assessment of the current situation with that regards. Thank you.
Thank you very much, Catherine. And to Jorge, I have a couple of questions for you as well. One, Abraham Chavez is asking Jorge about the crack and crystal meth epidemic in Mexico. He would like you to comment on this epidemic and how it has changed over the past 20 years. Graciela Humara is asking about the, let me say this in Spanish, la ley seca. She's asking how this law has worked in the municipalities of Mexico. And Catherine, we have a question from Catherine for you, Jorge. Do you have more information on domestic violence in Mexico? Thank you.
Bien, de la primera pregunta sobre cristal, bueno, es algo que está incrementando muchísimo. De hecho, en varios estados ya es la primera causa de ir a tratamiento, particularmente en los estados del norte. Sonora es uno de ellos, donde también tienen este problema de la heroína, pero es mucho más fuerte la parte de cristal. Igual en el caso de Baja California. Y lo que es toda la costa del Pacífico es donde se han visto los mayores incrementos de esto. Sin duda es un factor importante. Esperemos pronto tener datos más novedosos de parte del CISBEA y del Observatorio Mexicano con objeto de qué es lo que está pasando esto. Parte de los estudios que se tiene planeado hacer por parte del Instituto Nacional de Psiquiatría y estos manejados principalmente por la doctora Clara Fleiss es justamente trabajar qué es lo que está pasando con este consumo de crack en la parte fronteriza y no dejar de monitorear lo que esté pasando en otros estados, ¿no? Entonces, eso yo creo que es datos que nos estarán arrojando más que es esto. De los hallazgos originales o iniciales que se han tenido incluso en el caso de Sonora, donde he tenido mucha comunicación y ellos me ayudaron de manera importante para esta presentación, se ha señalado, y esto al parecer continúa, que varias jovencitas, a pesar de que no están gordas ni nada por el estilo, están utilizando el cristal en ese sentido para lo que sería adelgazar directamente o mantenerse delgadas, ¿no? Y ese es un uso bastante fuerte. Y otro de los elementos que también hay que indagar y creo que hemos dejado de lado es que en lo que son los desarrollos turísticos en construcción también se les está dando lo que sería algunos de los trabajadores como para que tengan mayor fortaleza y estén estimulados para continuar trabajando durante largas horas de sus jornadas, ¿no? Entonces yo creo que hay que seguir indagando esto porque sí es un problema importante. Del lado de crack sí hay unos estudios muy interesantes que por la parte de México ha comandado la doctora Guillermina Natera con Mario Domínguez y Zafra, que son unos buenazos también en estos trabajos de hacer el campo con los usuarios. Y los invitaría a leerlos. No estaría seguro de que fuera una pandemia. Los datos de las encuestas con escolares y con hogares nos muestran claramente que no hay un incremento tan alto. Sí está incrementando y sí hay que mantener la alerta, sin duda, pero los consumos de las sustancias se mantienen bajos, ¿no? De hecho, tenemos más problemas, por ejemplo, con los inhalables a nivel nacional, donde, por ejemplo, en la población de estudiantes, estos porcentajes están empatados directamente, ¿no? Entonces, lo que tendría que decir sobre esa pregunta, sobre la parte que corresponde a Graciela, aprovecho para hacer un saludo a todos los amigos que están conectados. Ya vi que hay mucha gente del país y muchísima gente de América Latina con quien he tenido el gusto de compartir muchos espacios, ideas y demás. Muchas gracias por estar presentes. O sea, se ha aplicado de manera diferencial. O sea, sí hubo una ley seca donde no hubo venta durante un tiempo fuerte, particularmente me parece que fue a finales de abril y mayo directamente donde estuvo, ¿no? Y también, ahorita se ha seguido y básicamente donde se ha presentado ha sido en lo que sería la parte de los fines de semana y no todos lados, ¿no? Ha habido estados donde la ponen, la quitan, la vuelven a poner, como sería el caso de Yucatán. Tenemos un documento ahí que con mucho gusto podemos compartir a quienes nos lo soliciten de cómo estuvo esto. Yo creo que la disponibilidad, no sé directamente si en este caso sea la ley seca, ¿no? Me cuesta trabajo pensar que una ley seca haga que haya menos consumo. Me parece que son más otros elementos los que han hecho que no haya tanto consumo como es el propio confinamiento, como si han habido mensajes muy importantes sobre los efectos del consumo de alcohol y del tabaco sobre la salud. y creo que eso tiene un impacto importante sobre la gente que consume poco, ¿no? Tal vez no tanto con la gente que tiene patrones de consumo más fuertes, donde habría que trabajar de otra manera. Sin embargo, pues los datos ahí están, ¿no? Habría que analizar después, con los datos disponibles en los lugares donde se mantuvo más, no acceso a las bebidas, pues realmente hubo una disminución. Bueno, evidentemente que va a haber una disminución porque no lo hay, ¿no? No está el alcohol disponible, pero también tenemos que ver si en algún momento determinado lo que sería el alcohol, más que ilegal, el alcohol adulterado, pues está generando los problemas como en la diapositiva que mencioné y que sigue creciendo, ¿no? Todavía en una nota de, me parece que fue ayer, todavía parece que había más de 17 muertos adicionales. Entonces, no sé si sea una buena medida. Yo creo que debemos de manejarla con cuidado, en particular con este aspecto, pero sobre todo respetando a la gente que tiene un problema real de consumo, ¿no? Y que necesita la sustancia porque si no va a tener un problema, ¿no? Y no solamente en el caso del alcohol, sino en el caso de lo que serían otras drogas, o por lo menos, por ejemplo, mantener con personas un contacto directo para poderles apoyar, ¿no? Y en este caso, donde hubo el cierre en nuestros países, es muy claro, y creo que la evidencia de Canadá y lo de nosotros muestra que los servicios de tratamiento se disminuyeron y que hay gente que no puede acudir a ello y que adicionalmente se saturaron las líneas no solo por la cuestión del alcohol, sino también por la cuestión de la salud mental, que probablemente es lo que se viene más fuerte en todos los países, ¿no? Entonces eso sería, digamos, lo que pensaría sobre ese aspecto. Y sobre la pregunta de Catherine, la verdad es que muy buenas sus dos presentaciones. O sea, les agradezco a Matthew y a Catherine que nos hayan presentado estos datos tan interesantes y el trabajo que realizan ahí en el centro de Canadá. O sea, bueno, están los datos ahí, están los datos, no los hemos podido revisar con claridad, con mucho gusto, o sea, son públicos totalmente, se los puedo transferir. Les puedo pasar la liga para que puedan ver un poco más esta partecita. Son los de Ciudad de México, los de la línea 911, no sé si estén en línea, lo voy a indagar con muchísimo gusto para conocer un poquitito más las razones de por qué esta violencia, ¿no? Sin embargo, sí hay datos reales de que esto se ha incrementado y hay que ver cuáles son los aspectos. Ahorita la doctora Luciana Ramos está por iniciar también un estudio de lo que ha pasado durante el COVID. Ella es una especialista justamente en violencia y seguramente nos podrá más adelante pasar información de cómo es esto. Muchas gracias.
Thank you very much, Jorge, for those very succinct responses. I'm going to actually answer the very first question that came in on the chat. This was from Lucas Pasos. Lucas was mentioning that there was a survey done at the University of Cauca where you discovered a decrease in the consumption of stimulants and intoxicants, and a high consumption of coffee and cannabis was the same as it was before. I'm quoting from what you said. And you're saying that this result was inconsistent with the results that were issued, I think, during my presentation. And your question is, what could have caused this? Was it the time that the data was collected? Your target population apparently were Columbian University students in Cauca. My response briefly, Lucas, would be that obviously it depends on the source of your data, the target population that you're looking at, university students. Timing obviously is also very important, and the type of study. I don't have a lot of information about how your study was done, how your survey was implemented. I would have to hear about that. But this is something that we can look at in a future webinar. For example, we have another question. We can't get to all of the questions, so apologies to the questions that we would have missed. For example, I wanted to hear from Catherine about what she would, for example, recommend to countries that do not have well-developed systems for taking samples for telephone surveys and things like that. What would you recommend for them to, methods for them to use to do these types of exploratory studies? This was also a survey from, a question, sorry, from Uki Atkinson in Jamaica. But we're considering, as you would have seen in the chat, doing a follow-up webinar where we will focus specifically on methodologies and ways that we can we get the information, get the evidence that we need to continue understanding the evolution of the drug problem, even during the COVID-19 pandemic. But I think this session was an excellent session. We heard from Jorge. We saw how you could take multitude sources of data, different studies, to paint a picture of what is happening in a particular country. Matthew, I think, shared with us excellently how you could use a network, and this is something that we've been pushing for the last number of years, how you can use a local network of stakeholders as sentinel sites to get the information you need about what is happening, and this too can serve as an early warning system for you. And I think Catherine did an excellent job in showing us how the internet and how the web can be used to do different types of surveys to find out what is happening with respect to drug use and other things. So with that, I would again like to thank the excellent presentations, the excellent presenters for your good work, and thank you for participating. And I will hand over to Maria, who is going to take us home. Thank you all very much. Is Maria there? We can't hear you, Paula. Oh, okay. Apparently Maria is locked out. So, yeah. So I guess it's on to me to first of all thank our donor for this event, the Government of Canada, for helping to support us with the Early Warning Systems project. I'd like to thank Ambassador Nam and Maria for their opening remarks, for basically setting the direction that we should go for this event. I want to thank Jorge, Catherine, and Matthew for, again, 3 excellent presentations. And the interesting thing about this event is that it allowed us to see how you can use different methodologies to understand what is happening in your country. As Paula would have indicated, all of the presentations are available in both languages in the document section on the right of this of Kudo, of this platform, and they will also be available on our webpage. With that, thank you also for your participation and for the excellent questions. Again, sorry that we couldn't get to all of them, but I think we answered most of them. And we're going to have a follow-up event where we will focus on the specifics of the methodologies that we can use to get more information during pandemics and other disruptions in society. Paula, if there's nothing else, I will hand over to you. I think we're having some challenges with Paula's. I think your microphone is muted, Paula. Yeah. So if there's nothing further, I'd like to thank all of you for participating, and I'd like to close the session. Thank you very much.
Muchas gracias. Saludos a todos.